Okay.
I legally voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. Given my express consent for this information regarding the physical assessment to be filmed and posted in the student's course cell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any of their devices as soon as it's been reviewed and graded by the instructor.
Okay. Wash hands. Hi, my name is Mandy, and I'm a nurse practitioner student, and I'll be performing your head-to-toe exam today. Can you please give me your name and date of birth?
Larry Ely, August 22nd, 1985.
Okay. So to start, we're gonna start with the head. Looking at his head, it is symmetrical. He's got equal hair distribution. Color is the same throughout his the skin on his head. He is appropriately warm and moist. No dryness, flakiness, or anything like that noted. Is this hurt?
Yeah.
Okay. So no lumps, bumps, or bruises, no pain. I'm not noting any lesions, any folliculitis, or anything like that. Okay. So moving on to the eyes. Okay. Just take a look at my ear. Okay. So pupils are round, equal, and reactive, about 3 millimeters. And they do respond to the opposite eye when you shine light into it. All right, take a look at this. Okay, and they do constrict and dilate to see the small print on this pen light. Close your eyes for me. Okay, so no palpebral fissures. The edges are approximated when he closes his eyelids. There's no gaps. The intercanthal folds are intact. Open your eyes. Look up. Okay, the conjunctiva is pink. The sclera is white. The corneas are clear. Okay. Red light reflex is positive. I can visualize the macula, the fovea, and the optic nerve, and those all look good, with the macula being the yellow disc. Next, moving on to the ears, they are symmetrical. Color is appropriate for ethnicity. They are warm. No abnormalities, masses noted. I'm gonna pull up and back because he's an adult and take a look. Okay, a little bit of cerumen. The ear canal is a little red, which is to be expected for him because he has allergies. The temporal membrane though is intact, no bulges. It's still pearlescent. And checking this other ear. A little more cerumen on this side. The canal does have some erythema, but the eardrum is intact. The tympanic membrane intact, pearlescent. No bulges. All right, breathe in, breathe in. Okay, so he does have some bilateral congestion. Okay. Taking a look. Does have some erythema, but no rhinorrhea. And then looking at his mouth, lips are intact. They're not dry, they're not cracked. They're appropriate for his ethnicity, and warm to touch. Say ah. Tongue out ah. Okay, uvula is midline. Tonsils are +1. Yep. Alright, so no sores in the mouth, mucous membranes are pink, intact, no masses, hard palate's intact, gums are nice and pink. Okay, so open and close. I like your yawning. Okay, so a little bit of popping and clicking when you check here for TMJ tenderness, any pain?
No.
Okay, and then feeling for the carotid, one at a time. Okay, +2. Trachea is midline, swallow. Okay, and I cannot feel the thyroid. Okay, so moving on to the chest, lungs, cardiac assessment. Looking at his chest, he's got equal rise and fall. He's not tripoding, no excess work of breathing. Respiration seems to be about 14 to 16 breaths per minute. His color is good, no barrel chest noted. So I'm gonna take a listen to him, anterior and posterior, all 4 quadrants, and I'm gonna percuss. The AP diameter is 1 to 2, which is correct. Okay, so lung sounds are clear throughout, no inspiratory, expiratory wheezing, no bronchi. I didn't feel any thrill when I felt for the carotids, and when I listened to the neck, I didn't hear any stridor or bruit. While he is sitting up, I'm going to percuss, and I'm going to listen for resonance. Okay. And resonance can be heard. I'm also going to have him lean forward and listen to the second intercostal space mid-clavicular for some aortic regurgitation. Okay. Lean forward. Okay. So no regurg noted. And I'm going to check his back for CVA tenderness while he's sitting here. All right. Any pain? Okay. I'm going to have you lay flat on your back. All right. While he's on his back, I'm going to assess his neck. No jugular vein distension. Still good rise and fall. And then we're going to take a listen to aortic, pulmonic, Erb's point, mitral, tricuspid, aortic, renal, iliac, and femoral arteries. So second intercostal space to the right, second intercostal space to the left, third intercostal space to the left, fourth intercostal space to the left, fifth intercostal space to the left, but mid-clavicular. Okay. Also listening to PMI at this time, and it sounds normal. Have you go ahead and roll over to the left. Okay. So I'm gonna listen to the fifth intercostal space again. for mitral stenosis, which I do not hear. S1, S2 heard, no gallops, no rubs. I also didn't hear any rubs when I had him leaning forward to come back and get back. Okay. Have you go ahead and bend your knees. And then I didn't hear any, I don't see any pulsatile masses in the abdomen with his knees bent. And I'm gonna listen again for those, the aortic, renal, iliac, femoral, and then I'll listen over the liver and the spleen as well for any abnormalities. Okay. So I'm going to take a listen to all 4 quadrants. And again, just the same way I inspected earlier, equal rise and fall, no abnormalities. The skin is consistent, skin color is consistent throughout and appropriate for ethnicity. At this time, I'm going to palpate gently first. Any pain? Any pain? Okay. So no pain on palpation. Stomach is soft. No guarding. Umbilicus is midline. Gonna do some deep palpation. Okay. Take a breath in and hold it. Okay. Breath in and out and hold it. Okay. Can't palpate the spleen or the kidneys, which is normal, and the border of the liver is about 8 centimeters down. Okay. So dullness in tympani is as expected, dull over the solid organs and the bones, and tympani down where he doesn't have any solid organs. I'm going to check his pulses at this time. So radial pulses are +2, brachial pulses are +2. Okay. I cannot palpate the epitrochlear nodes, which is normal. Palpating the axillary lymph nodes. About 2, non-tender and mobile. Okay. I'm gonna go ahead and check the femoral pulse. Okay, those are equal. Popliteal, +2 and present. Posterior tibial. Okay, dorsalis pedis, +2 equal. Looking at the legs, no edema, hair distribution is even, no signs of venous insufficiency, no edema, any pain, no pain, no tenderness, skin's intact, no bumps, no lumps, no rashes, no masses noted. Okay. I'm gonna have you raise your legs up one at a time. Open them, close them. Okay, I'm gonna have you roll on your belly. Bring your legs up, in, and out. Okay, you roll back over for me. Okay. I'm gonna have you put your shoes on and walk across the room and then heel toe back. And there's a cat here. Okay, you stay right there. right here for me. All right. Hands down by your side. Now close your eyes. Okay, and this is the Romberg, and we would do this for 30 seconds to see if he were to weave. Okay, eyes open, arms out in front of you, palms up, close your eyes. All right, and this is the pronator drift test, and we would check to see if his arms fall, and this again would be another 30 seconds. Eyes open. Okay, arms up, back, out, cross. Okay, arms out, palms up, bend your elbows, and flex. Okay, make a fist, open, fingers out, fingers in. Okay, and then chin down, chin up, look left, look right, ear to the left, ear to the right. Okay, and then reach back behind your shoulders, and then overhead. Okay. Have your arms up again. Okay. And this is checking the scapula. Okay. And then the flexion, abduction, adduction of the hands and arms and elbows, and then of the neck. Did you lean back? Lean back, turn left, turn right, and then move laterally left and right. Okay, all right, you can have a seat. Okay. All right, so next we're gonna test your coordination with your hands. I want you to touch your nose and then touch my finger as fast as you can go. Okay. All right, close your eyes. Hold this. What is that?
Rectangle box covered deck of cards.
Okay. What's this?
Television remote control.
Okay. Tell me soft or sharp.
Soft. 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 Sharp.
Sharp.
Sharp. Sharp.
Okay. Tell me one or two.
1, 2, 2, 1.
Okay. All right, open your hand. Tell me what letter this is.
A. C.
Okay. All right, I am going to check your reflexes. Okay. Break your radial. Bicep. Nope, just let it hang. Tricep. Okay. Relax your legs. Patella. Achilles. Relax this way. Patella. Achilles. Break your radial. Bicep. Tricep. Okay. All right. Push. Pull. Okay. Spread your fingers out. Don't let me close them. Close your fingers. Don't let me open them. Okay. Push out. Push in. Up. Okay. Yep. Push down. Pull up. Okay. +5 on the strength. Alright. So I'm gonna palpate your lymph nodes. Just let me know if any of them hurt. Alright, so preauricular. Any pain? Postauricular. Tonsillar. Submandible. Submental.
No.
Occipital.
No.
Supraclavicular.
No.
Posterior cervical.
No.
Deep posterior cervical. Okay, so that's all the lymph nodes, and then we're gonna hit the cranial nerves. First cranial nerve is olfactory. Close your eyes. What is this?
Citrus.
Okay. Can you read that eye chart for me?
EPTZO.
Okay. And that is 20/30 vision. And that is cranial nerve 2, which is the optic. Cranial nerve 1 was the olfactory. Follow this pen light for me. Okay. That's cranial nerve 3, 4, and 6. Ocular, motor, abducens, and trochlear. Cranial nerve 5. Open and close your mouth real big. Okay. That's 5. Cranial nerves, and that's trigeminal. Cranial nerve 7. Is this what it's saying?
Mm-hmm.
Okay. That's the facial nerve. Cranial nerve 8 is the vestibular cochlear. Cover your right ear.
$6.29.
Cover your left ear.
$8.15.
Okay. And that is the vestibular cochlear. All right. Get you to swallow for me. All right. Stick your tongue out. Say ah. Okay. That's cranial nerve 9 and 10, which is the glossal, pharyngeal, and the vagus. Also for vagus, you could stick a tongue depressor down the throat and gag him, but I am not going to do that because he is conscious. All right, shrug your shoulders. Okay, that is accessory, which is 11, and then stick your tongue out, up, down. Okay, and that is cranial nerve 12, which is the hypoglossal. Trying to think. I did your heart, did your lungs. Okay, so the muscles under his skin, no fasciculations, skin's intact throughout. Did your carotids, did your pulses, did your reflexes, did your strength. Okay, that's it. Thank you so much.